Carie was founded 36 years ago. At that time, many of the programs we take for granted today, Medicare, Medicaid, and the Older Americans Act, were barely a decade old. Carie was founded as a coalition of groups, including the Gray Panthers, the Lutheran Council on Aging, and the Friends Committee on Aging. The coalition identified issues of oversight for those who were most vulnerable in nursing homes, personal care homes, and receiving home care. While our early work to impact policy remained critical, it didn't take very long to learn that people needed a place to turn for help. Our Carie line was created to take calls and help callers understand their options and resolve their problems. Our mission to improve the well-being, rights, and autonomy of older persons through advocacy, education, and action best describes our current objective. We have been steadfast in our focus on this agenda since there are many seniors who cannot navigate through the bureaucracy. This is why we use a case-to-cause model, helping individuals and effecting systemic change through education and public policy initiatives. It is critical to our mission that we help everyone who calls upon us. We need both human and financial resources to fulfill our mission and meet the needs of older adults. Our professional training series, Competence with Compassion, includes elder abuse prevention training, long-term care ethics, and a unique person-centered core curriculum for long-term care staff. All of our programs are professionally developed by experts and subject to rigorous evaluation. We are focused on public policy, and our volunteer committee has been active for more than 30 years. We work with others to advance our agenda. For example, through our direct advocacy, we identified issues related to access and inclusion for LGBT seniors, while the local LGBT community began to realize that its population was aging, needed culturally competent services, and were afraid of the consequences of once again coming out. The groups came together to form a partnership to advocate for access and inclusive programs for seniors who identify as lesbian, gay, bisexual, or transgender. Simply stated, it's Carie's dedicated people that make us effective. Carie's management team of 5 has a combined 100 years of service. Our board comes from various walks of life, but what brings them together is a commitment to Carie's mission. They each have a story to tell. Although our staff is small, our impact and outcomes far outweigh our human resources. Our more than 100 volunteers extend our reach by making presentations, helping senior victims, advocating for those in long-term care, and as our ambassadors. We have a database that tracks how many calls we get on our Carie line and how we've helped each individual. We have worked extensively with experts to develop a system to identify our outcomes and the impact of our work. More than 95% of our callers report a positive change as a result of their contact with Carie. Whether we have helped someone cut through red tape, obtain better care, access public benefits, get meals delivered, expose health care fraud, or access housing, we know we are successful when people tell us they are doing better after our help. It's most disheartening when I hear someone say that they wish they had known about Carie when their mother had her stroke, or when they were trying to figure out Medicare Part D, or a myriad of other issues. We want people to know that we are there for them, that we can help, before they suffer the consequences of not knowing where to turn. Carie is unique in its long history of advocating for older adults. We work to make sure that everyone finds a resolution to their problem. The Center for Advocacy for the Rights and Interests of the Elderly has advocated on behalf of hundreds of thousands of older adults. We've helped to establish adult protective services in Pennsylvania, worked on nursing home reform, helped establish licensure and standards for assisted living, trained thousands of direct care workers across the country, helped in the fight to expand home and community-based services, and much more. We are most proud of helping those who call us every day, whether it is about Medicare, a utility shutoff, crime, abuse, transportation, housing, or any of a multitude of problems facing seniors today. We have scarce financial resources and need to consistently evaluate that resources are used in the most effective way. We are committed to our mission. This means that we avoid seeking funding for projects for other than the work we do best, advocacy. Carie has had challenges being understood. Our founders gave us the name the Coalition of Advocates for the Rights of the Infirm Elderly. We found as time went on, not only did we cease to function as a coalition, but the term infirm had negative connotations. On our 25th anniversary, we changed our name to the Center for Advocacy for the Rights and Interests of the Elderly. We no longer see people walking away from us. Now they want to join us. If we had more resources, we would establish a reserve fund so that we never have to worry about whether or not we will be able to help the next person. After that, we'd continue to strengthen the work we do every day to help those who contact us, increase our outreach, and expand our advocacy. Several years ago, to expand our reach, particularly to busy caregivers, we established a website called Caregiver GPS. We help caregivers think through decisions related to the best setting for their loved one and how to navigate a confusing array of services and competing advice. With more support, we would enhance this program. We developed a white paper on the unbefriended with dementia. Later, I attended a national conference when someone from the Alzheimer's Association thanked us for bringing the issue to the forefront. Since then, the Alzheimer's Association has been doing more to reach out to those who do not have caregivers, and a national discussion has ensued. We could bring attention to many more issues like this through more white papers and the mobilization of our volunteers, consumers, and colleagues to help us bring about change through education and action.